Hello everyone. Hi. Hi. I'm just waiting for a couple of more people to join in. Hi. So to introduce myself, this is Sakshi Shah from Humans of Ahmedabad. I cover stories at Humans of Ahmedabad and I also help in creating content. It's been about 3 months now and it has been really incredible. Okay, so straight off the bat, the topic of today's discussion is, are you at the risk of heart attack? And for the same, we have Dr. Tripathi from Zydus Hospital. He's a cardiologist and he's a gold medalist. I am just waiting for the doctor to join in.
Hello, Sakshi.
I can't see you.
Hello. Am I audible?
I can't see you, sir.
Audibility is an issue. Hello.
I am so sorry for the inconvenience. Uh,
Am I audible?
can you see me?
Yeah, I can see you.
I can't see you. And there's a lag between your audio and your video.
I can see. I can see myself also. I can see you also.
Give me a minute. Okay, hi.
Hi.
I am so sorry for the inconvenience. Yeah. Hi, am I audible now?
Yeah, absolutely.
Yeah, so I just gave a quick introduction before you joined in, but we don't want to miss out on anything, so if you can do that again.
I'm Dr. Abhisheka Tripathi. I'm working as an interventional cardiologist in Zydus Hospital.
Okay, hi. So let's get the live going. Yeah, so the first question is, what is heart attack? How will you define a heart attack for a layman?
For a layman, a heart is there. This is the one of the most important organ of the body, and heart is there in the center of your chest. This is the size of your fist, and heart is a bag made up of muscles. And the main function of heart is pumping. It pumps blood in the entire body. But naturally, since heart is working, heart also needs blood, and the heart receives its blood supply and nutrition through vessels which are called coronary arteries. You have three coronary arteries and branches, and the entire heart is supplied by these vessels. Now, as we grow old and as we develop certain disease and risk factors, the arteries, the walls of these arteries, they start developing some kind of cholesterol deposition, which we call atherosclerosis.
Right.
During heart attack, what happens? That this plaque, this ruptures, or it has an ulceration, or it breaks. The moment it has an ulceration or break, it forms a clot there. When the clot is formed, the entire vessel is blocked. There is no blood supply in that vessel. So it blocks the entire blood supply to that area of the heart, and this causes this entire area of the heart, which was being supplied by that particular artery or branch, starts getting getting damaged. This damage is called heart attack. Now the degree and severity of heart attack depends what was the degree and severity of blockage and what was the duration of blockage. If suppose the blockage was dealt early and it was opened early naturally or by medicine or by intervention, the damage and heart attack can be controlled. If it is not managed within time, then the entire area of that heart can be dead. This can cause death of the patient or can cause permanent weakness in the heart.
Okay, right. Also, a quick heads up for the audience. The doctor will also be entertaining the questions at the end of the session. So, please comment your questions. Okay, so moving forward, could you tell us quick key health indicators of heart attack? Is it possible to know if I am at the risk of heart attack?
These are the risk factors, actually, we call not health indicators, the risk factors. And on the basis of those risk factors, we can get an idea who are the people and who are the patients, those who are at a higher risk of heart attack than the average population. So these risk factors we divide basically in the three categories. One is the risk factors related with lifestyle related risk factors. The second is risk factors related with other health conditions. And third group comes as non-modifiable risk factors. If I first talk about the lifestyle related risk factors, this includes first regarding physical activity. If you have a sedentary lifestyle, like most of the patients, they come and say, I have enough money or I don't walk much. I start from my bedroom to my house to lift to car to office, back to car to my home. So I don't walk much. And in office also, mostly the job is desk job. So if you're having sedentary lifestyle and not doing moderate to heavy physical activity, definitely you are having an additional risk of having heart attack. Second point comes regarding your weight. If you are overweight, like if your weight has to be as per your height. If your BMI, we calculate body mass index, is BMI more than 25, particularly in India, if it is more than 23, you are overweight. If it is more than 30, so if your weight and adequate weight what is required as per your height, then again you are at a higher risk compared to a person who maintains a normal weight. Mind it, both the things are bad here. If you are overweight, even then it is a risk factor. If you are underweight, severely underweight, even then it is a risk factor. Third point comes regarding diet. If you are taking unhealthy diet, if you are taking too much of fast food, fatty substances, the food items which contain trans fats, if you are getting too much of sugar containing things, again then you are at a higher risk than general population. So your diet, your exercise, your body habit, everything plays a significant role in maintaining or extra risk of heart. Coming to smoking, smoking again comes in your habit, and those who are smoking are having any kind of tobacco consumption. So if you are consuming tobacco in bidi, cigarette or kind of gutka or anything, you definitely have a higher risk, and particularly tobacco significantly increases the risk of heart attack. It also increases the risk of other disease, which will not go in detail of those things. But heart attack risk and risk of sudden death, it increases significantly. So these are the common lifestyle related risk factors that if you are not maintaining these things, you are at a higher risk. Coming to the risk factors, like if you have some other disease, you are at a higher risk. Like if you have hypertension, which is a very common disease, almost 2/3 of Indian adult population, they have hypertension. If you are not aware of hypertension, or if you are not having hypertension under control, then you have a higher risk than the general population, than the other people. Same thing stands for diabetes. Diabetes stands peculiarly high because if you're having diabetes, the risk of heart attack and heart disease goes significantly high. And having multiple diffuse blocks, it goes significantly high in patients of diabetes. So if you have uncontrolled diabetes, your risk of having heart attack or heart disease is significantly higher. If we have seen the patients, those who are having abnormal cholesterol level, if you have dyslipidemia, LDL cholesterol, bad cholesterol is high, again this also causes a higher risk of heart attack and heart disease. Patients with other disease, most commonly we see like chronic kidney disease. The kidney disease patients, they have a significantly higher risk of heart disease. So these are the common diseases which we have and which predisposes us for a higher risk of heart attack and heart disease, and the lifestyle factors. There are certain risk factors which we can't modify, like age. With every passing year, with every birthday celebration, we are going to grow older only. So as the age advances, the risk of having heart disease, it goes high. And like in Western country, the most maximum patients, they after 65 years of age, they get heart attack. In India, the risk is much earlier. From 45 to 65 years of age, we get the maximum number of patients because of our genetical predisposition, dietary habits, and other things. So age is one factor which we can't control, but we have to be aware. Second thing, male gender. Like we all know that male are more predisposed to heart disease than female. Till menopause, females are having a natural, not absolute, but natural protection against heart disease. But after menopause, by the age of 50, 60, they start catching up male, and they come by the age of 65, they have almost similar prevalence of heart disease like male. But in the early age, they have some sort of protection. So in gender also, we can't do much about these things. Then comes your family history. If you have a family history of heart attack, then your risk, and particularly in a young age, then your risk of having heart attack is definitely significantly there. We do get some families where the risk of heart attack or the history of heart attack is there, like the father had heart attack, uncle had heart attack, the elder brother had heart attack. So these kind of families, they have a significantly higher risk of heart attack than general population.
Okay, so this was the case about normal people. But what about the people who have already a pre-existing disease of heart, or who have gone through angioplasty or coronary artery bypass grafting and all of that. So, what is your say in that case?
Those patients, those who have pre-existing heart disease, like they had a heart attack, maybe it was managed medically or with some intervention, or the patients who underwent angioplasty or bypass, they have a higher risk of heart attack or heart attack than the general population. Because once you already had got a heart attack disease is already established in you. So in these kind of patients, we work for secondary prevention. That second episode should not come in these patients. So in these patients, if they are not maintaining a healthy lifestyle, then the risk of having second episode of heart attack goes significantly high. One particular peculiar behavior has been noticed in these patients, like if they are non-compliant regarding their medication. If you are not serious regarding a medication, particularly what happens when you have a heart attack, in the first 1 month, 2 months, 6 months, 1 year, you are quite motivated to take medicines regularly. Once 1 year, 2 year, 3 year passes smoothly without any difficulty, the patient, they become reluctant or they become little bit ignorant regarding their medications, which is a dangerous behavior. If you compromise or become non-compliant towards your medication, this becomes a serious problem. Third thing I would also like to mention, for those who had heart disease or who did not have heart disease, sometimes there's ignorance of symptoms. Like in good number of patients, what we see before having a massive heart attack, they have some kind of warning symptom. Suppose if an elderly gentleman is there who was daily walking for 4 kilometers, but since last 15 days or couple of weeks, he is not able to walk 2 kilometers, or after walking 2 kilometers or 1 kilometer, he has some chest discomfort or he has some breathing difficulty. So this is a warning sign. Or if you are climbing every day 4 flights of stairs, and suddenly since last 3 days, 4 days, in climbing those flights of stairs, you are having some breathing difficulty or chest heaviness. So these are warning symptoms. Or stuttering kind of attack, when you had some kind of chest heaviness and it went off. 2 days back you had some kind of chest heaviness and with perspiration and went off, and then you took it lightly. You did not seek any medical attention. So these kind of things, if you ignore your early warning symptoms, then it may culminate into a massive heart attack.
Right. So, ignorance is a bliss until it comes to heart diseases. Okay. So, talking about the risk factors and reducing them, how do we prevent the risk factors?
As I mentioned, like we have mentioned all the risk factors. If you see one by one, them sedentary lifestyle, as I mentioned regarding the lifestyle. So we should try to avoid sedentary lifestyle as much as we can. What happens most of the time when we advise our patient to have active lifestyle, do some walking or physical activity and some moderate exercise, they say, in my work I have to walk this much, or in the entire daytime I walk for 5,000 steps, 6,000 steps, or I have this kind of work where already some physical activity is there. So in all these patients, definitely I would like to advise them that outside your work, you try to have some moderate to high level of your physical activity. Now, physical activity should be, in particularly in heart patients, physical activity should be as per the advice of your doctor or physician, whoever is seeing you. In those who are not having heart disease, they should be trying to have at least 30 to 45 minutes of walk or jogging or cycling, some kind of active sport like tennis or badminton, where they are doing some vigorous physical activity, at least 5 to 6 days a week. So this is what is recommended. So if you are living the sedentary lifestyle, going towards more active, moderate to heavy exercise and physical activity, definitely your risk significantly decreases. Now, second point comes regarding maintaining a weight. As I mentioned, you know, being overweight or being obese, definitely this is an added risk factor. So you try to maintain an adequate weight, what is required as per your height. Diet, which is the, I think, simplest thing, it is still most complicated and the most difficult to follow religiously. Because diet,
Right.
it has evolved in a period of thousands of hundreds of years as per the culture, and it varies from Kashmir to Kanyakumari, from every state, it varies. So in
Definitely.
diet, we need to be very, we need to use common sense, and we all know what is harmful. When we indulge in all these sugar-containing and free sugar-containing things like ice cream and cold drinks and sweets and all these things, we know this is harmful. In fast food, we know this is harmful. The deep fried items containing trans fats, we know this is harmful. So these things should be avoided first. In healthy people, we can't completely put them on a specific kind of diet, but if they start avoiding these kind of unhealthy eating behavior, this also significantly helps in controlling our risk factor and risk. Smoking or any kind of tobacco consumption, if you are doing, you should absolutely quit. There is absolutely no, should not be any excuse in continuing it. Many times the patient becomes like, I am not a smoker, occasionally I smoke. If you ask what is occasionally, so some will tell daily 1 or 2 cigarette, some will mention like once in a week or twice in a week. So believe me, even a single cigarette smoke is definitely harmful. So try to quit smoking as best as you can. And not only active smoking, passive smoking also has to be avoided. Because many times we have asked the patient, you ask that, do you smoke? They say, no, I don't smoke. But they are sitting at least 3 times during their coffee time or tea time that 3 of their friends are smoking. So in passively, without knowing, by the end of the day, he is smoking 1 or 2 cigarettes. So active and
Right.
passive, both kind of smoking should be completely avoided. If you have disease like risk factor major like hypertension, diabetes, or cholesterol abnormality, you should get them under control, because blood pressure, diabetes, and these things you can't remove, you can only control. Most of the time, what happens, the patient, you know, when they come with high blood pressure, you start medication, and once the BP comes under control, they stop medication. They feel like it was like fever. Fever is controlled, we can stop medicine. But this is lifestyle disease, hypertension, diabetes in majority patients, 99% patients, it is not going to go. Even if medicine has to be decreased or tapered or stopped, you should take the help of your physician or doctor, whoever is seeing, whether it can be decreased or stopped or not. So having a good control of blood pressure, diabetes, or other risk factors, it helps significantly in decreasing your risk for heart attack.
Right. Okay. So talking about the current scenario, COVID, and I'm hoping on that note that everyone is safe. My question to you is that, all of us are going through this for the first time, and we don't know what effect COVID will have in different systems of the body. But is there any research or studies going on, so as to suggest that corona has a long-lasting chronic effect on heart?
Long lasting will not be a right word, particularly for COVID, because we know
Or
COVID
maybe temporary effects,
yeah,
which, improvise over the time?
absolutely. So I'll come to that. So long lasting we can't say, because we know Corona in total since 8 months, in India since six
Right.
months. So,
Definitely.
but it has been seen that those patients who have significant COVID infection, significant involvement of lung in this, there, almost 7 to 10% patients, they have heart involvement also. The heart involvement can be in various forms. Some patients, they are having actual blockages of vessels, the fresh blockages of vessels, and they come with heart attack. Some patients, they are having myocarditis, which is not exactly heart attack. There's inflammation of the muscles of the heart, and this causes weakness of the heart and heart failure. So this is the two very common presentation we have seen, like heart attack and myocarditis and heart failure. Now long term, definitely we have to wait and watch, but like as we see for other viral myocarditis, these patients, if treated timely and given the optimal medical therapy timely, they have a good chances of recovery. But long term data, since it is not available, we can't comment on the long term things for heart.
Right. Right. Okay. So minutes, so once the heart attack has actually happened, the minutes after it has happened are very critical for the patient's outcome. You know the knowing what to do between the time you have actually called the ambulance and it arrives is very critical for the survival rate. So what are the immediate measures that the patient's family must know and must ensure?
This is a good question, but what I would emphasize more, that if you have suspected that I am having a heart attack, please don't waste your time in self-medicating. Why I have emphasized this? Because in good number of patients, believe me, almost in 50% of patients, they are having this symptom. For in a well-aware, educated patient also, they are having symptoms since 3 4 hours, sometimes for half a day, sometimes for one day. but they confuse it with some kind of gastritis or acidity, and they keep taking some kind of antacid or taking some homemade therapy and all these things, and they lose the crucial period of time. So if at all you are suspecting that you have a heart disease, please don't try to self-medicate. Reach to the nearest best facility available, which has all the facilities where everything can be managed. So first thing, don't waste time trying to self-medicate. Now for the patients who are already on taking some heart medication and known case of heart disease, so in those patients maybe they can take one extra dose of blood thinner and can reach to hospital. One old practice like taking sorbitrate below your tongue, so that is not a
Right.
good practice. Sometimes it causes problem. So it only gives you pain relief. In certain kind of heart attack, this can create problem. This can create your hypotension, BP can go down, and the management can become more complicated. So that is not a great practice. Rather than taking sublingual tablet or anything, you better reach to a nearest facility as early as possible. Coming to the minute thing, minute is extremely important. Why I
The
emphasize, because
medical emergency, basically.
absolutely, absolutely. So what happens if you are having a heart attack and if you reach to the hospital and the things are done or the vessel was opened within 60 minutes, almost 100% of your heart, that area will be salvaged. If it is delayed by 3 hours and up to 6 hours, almost 50%, 40% of the heart of that area is damaged. If it is delayed by 12 hours, almost a major benefit is lost. So this is why if you have a suspicion of heart attack, try to reach the hospital immediately. In fact, on the basis of that, we have certain guidelines and certain recommendations also, like how much time patient will take from coming to his home, recognizing his symptoms, taking some help, coming from his home to hospital. That is not in our control. This is why we keep educating that if you have any symptoms, please reach to hospital immediately. But for our standard, it is door to balloon time. Like if the patient enters in our emergency, so from entry from door time to balloon time, like the time I have taken to open the vessel. So the entire time the patient's coming in the emergency, his ECG, his other basic blood reports, his assessment, talking to family, consent, shifting and doing angiography, opening the vessel. Everything, this entire duration of time should be less than 90 minutes. If you achieve this thing in less than 90 minutes, the patient outcome, it improves significantly. And fortunately, with the grace of God, with the help of all the facilities, we are achieving this time significantly. Most of the patients, in half of that mentioned time, we are achieving this result.
Okay. All right. Uh, so after, having a heart attack is obviously a life-altering experience, and more than likely the patient takes weeks or months to actually cope up with the situation. And although everything may feel up in the air, there must be some steps that the patient has to take in the recovery period just to hasten the recovery, or to protect the heart from long-term damage. So what are the basic concerns in the recovery period?
When the patient comes to us, we have managed the patient, and when the patient comes back in ICU, the first thing, the patient should be given enough confidence that everything is fine. We know what are the inherent
Right.
risks. We know what are the inherent complications. We discuss these things with family. Most of the time, we don't try to involve in this crucial time patient directly, because patient psychology is extremely important. He should be given
Right.
confidence. The family should be given confidence that this is a disease. This is not end of life. One heart attack, if you have survived, if you have managed, it is not end of life. So this is a disease. This only makes us more appropriate and makes us more acceptable for the changes what we need. We should be making in our life. Like once we have got a heart attack, this is not end of life. Normally, after 7 days, we ask the patient, like from the second day only, they start walking. So we make them sit on the side by side of his bed, and by evening they start walking. Well, once they are on their feet, once they start walking, their confidence doubles up. The family's confidence doubles up. Yes, patient is good. So they should be allowed the physical activity which you feel and which you feel justified and the patient can do. They should be doing those physical activity. They should be help in being positive, patient as well as family. Regarding medication, effect of medication and the importance of compliance of medication is extremely important, and each and every patient and family should be the time should be spent with the family and patient to make them aware regarding the compliance and all these things. Regarding the physical activity, gradually they can increase their physical activity. Normally, most of the patients, if the heart is not severely damaged, by fourth or fifth day, they start walking confidently for 10 minutes, 15 minutes, at
Okay.
least 2, 3 times a day. So, walking, a healthy diet, compliance with medication, and quitting all the bad habits, control of all the risk factors. This is what is required in the patients who are recovering from heart. But most important thing, again, I would say, be in a positive mindset. Having a heart attack doesn't mean end of life. Life is there, and the that motto should be, I should not be having second heart attack. This should be the motto.
Right. Preventive measures for the second heart attack.
Yeah.
Right. I will just take questions from the audience. Okay, so Vedanshi asks, how frequently is it necessary for a person to visit the doctor for a regular checkup of our health to keep a heart condition in check?
See, this is a good question because what happens most of the time, the young patients they come and they say, is it possible to have a heart disease even though I'm absolutely healthy? I don't have diabetes, I don't have hypertension, I don't smoke, I don't have a family history. I'm walking every day for maybe 5 kilometers, 4 kilometers. So I will give you a real example, and there are many examples, but I will give you two examples. One 36-year-old gentleman, young person, and one 40-year-old person. So what happened? He had absolutely well-maintained body, but and no hypertension, no diabetes, no family history, no smoking, nothing. So when we took them on table, I still remember because they asked me on table, sir, why me? I don't have all these things like what we see in newspaper or what we see in TV. I have nothing of
Mhm.
them. I walk every day 5 kilometers. In fact, one of them was marathon runner for 10 kilometers per day. So in these patients, it is important that you are healthy, but probably your arteries are not healthy. And there are certain things which makes arteries less healthy than what you are. And the risk factors, what we have found in young patients, the family history is very important. If you, even though you are absolutely healthy, but if the family history was there, like father or uncle or your cousin brother or your own brother, they had a history of heart attack early in their life, your risk of having heart attack, it goes high. Second thing, what we have seen, the stress. Stress we don't mention, we don't measure, but stress has a significant role in these patients. And one patient who was marathon runner, so he used to take extreme stress for these small things happening around him. So stress also has to be controlled. So coming to the Vedanshi's question, like how frequently we should go. If you are absolutely healthy, if you have no risk factor, if you have no significant family history, maybe once you are 30, 35 years of age, you can get heart basic health evaluation once, and then if everything is normal, maybe after 5 years. Those who are having heart disease or those who are having risk factors, and particularly those who are above 40 years of age, having hypertension or diabetes or dyslipidemia or family history or smoking history, they should be going for annual or at least once in 2 years. They should be going for their non-invasive kind of checkup, where we do simple
Right.
ECG, echo, and stress test, and it gives an idea whether how much heart disease has progressed in you. Those who are having
Yes.
existing heart disease, those who have got a heart disease, they should take the advice of your doctor, current treating doctor, and he can advise how frequently you need, monthly or once in 3 months or once in 6 months, depending on your health condition.
Okay, coming to the next question, Rajan Agrawal Ford asks, we usually see the word EF 50% are so common. What does it mean?
EF is ejection fraction. The normally
Right,
ejection
yes,
fraction is how much blood comes in the heart and how much it pumps out of the heart to the entire body. So ejection fraction is the normal healthy heart has ejection fraction up to 55 to 70%. So 55 to 70% ejection fraction is absolutely normal. Majority of patients we have 55, 60, 65%. Any number is good. It's not. It doesn't mean that 65% EF or 70% EF is better than 60% ejection fraction. If you are having ejection fraction less than 50%, then you should get a further thorough checkup that what is the reason why my ejection fraction or heart pumping is less and what should be done to correct it, or at least what should be done so that it should not fall further. So EF basically rejects how much the percentage of your heart pumping.
exactly.
Normal pumping
Right.
is not 100%. Many patients, even though we give ejection fraction 60%, they get disappointed. It's only 60%. We said this is normal. You can't get 100%.
Yeah, because the blood has to stay in ventricle. Yeah.
Absolutely.
So, okay, next question. Ritik asks, does having stressful condition bad for health of heart?
Absolutely. What I mentioned, like in many patients where they are absolutely healthy and having no other these measurable risk factors, still they are on the risk of heart attack if they take undue stress or anxiety. So in one of my previous talk also we have in detail mentioned that if you take undue stress or anxiety, too much anxiety, this causes rise in heart rate, rise in blood pressure, and this may cause deterioration of your health condition, overall health condition, including heart.
Okay, okay, all right. I think we're almost done. Okay, thank you, sir, for joining in. It was really informative. Even being a medical student, I didn't know about the fat sorbitol and everything. Even I didn't know about all of that. So thank you for joining in. Thank you, everyone. Relevant questions too. Okay, signing off.
Thank you.
Bye. Thank you.